Madinah Institute for Leadership and Entrepreneurship, MILE.
بسم الله الرحمن الرحيم. الحمد لله رب العالمين والصلاة والسلام على نبينا محمد وعلى آله وصحبه أجمعين. إخواني وأخواتي السلام عليكم ورحمة الله وبركاته. First, I'd like to thank you, Dr. Muhammad, for giving me the opportunity to be able to speak here today. Actually, today I have two big challenges. The first challenge that I'm speaking just after Dr. Walid, and this is for me, a real challenge, so I'll do my best. And the second challenge that I'm addressing you now today after your lunch. So hopefully that you'll stay awake. My presentation today, I would like to talk about the role of retail pharmacy in healthcare. And actually posing a question, is there a role for retail pharmacy in healthcare? So I'm going to cover in my presentation today some introduction about Al-Nahdi. And I'm assuming that all of you are customers for Al-Nahdi. But I would like to share with you some of the information about the inside of Al-Nahdi. Also, I'd like to share with you some of the challenges and the healthcare assessment in Saudi Arabia. Also, I'd like to share with you patient-centric model and proving the concept. So I'll start with the first thing is the logo. I'm sure that you start to recognize the logo in all the streets. We launched our new corporate identity just last month. Just for those of you who are not yet clear or familiar about the meaning of this logo, this is a shield, dir, and all these different colors representing our chain of pharmacy across the kingdom. Each color will represent certain categories and activities we provide. And in the middle is the white heart representing the community. So our group of pharmacy are surrounding community and trying to keep community white, clean, away from diseases and prevention and awareness. So this is the real meaning, and it's representing and reflecting our strategy that the community is in the center of our focus. Our vision أن نعرف دائما ونكون الرواد في مساعدة المجتمعات لحياة أكثر صحة وجمال. If you notice here أن نعرف دائما وأن نكون, this gives us a lot of challenges that we have to live that, and we have to really to work hard in order to be recognized and people can see us that we really help communities live healthier and more beautiful life. In our mission statement, الريادة في تقديم أفضل الخدمات والمنتجات, and if you notice here that we are putting services, and that's something not usual with retail pharmacy that usually sell product. التي تساهم في تحسين الصحة العامة للمجتمعات التي نخدمها. نسعى إلى التميز واستقطاب أفضل الكوادر ونساهم في خدمة المجتمع. We have a set of values. These values are not here for the presentation, are not here to be hanged on the wall. It's really something that we live with, and we lead by example with that. So leading by example, interdependency, integrity, commitment, and excellence are our values. We have over 2,000 qualified trained pharmacists. This is the largest group of pharmacy by far in Saudi Arabia. Ministry of Health, they have 1,500 pharmacy. All government sector, that's military hospital, National Guard, education hospitals, they have another 1,500 pharmacists. So under the umbrella of Al-Nahdi, we have 2,000 very well trained pharmacists, and this is a huge number of pharmacists, and they're supposed to contribute to this community. We invest in those pharmacists. We invest in those pharmacists from the time we select them and interview them, when we recruit them. We have designed a unique induction and training program that gives all the fresh pharmacists joining Al-Nahdi a very good training before they get to the pharmacy and start serving community. Today we have over 675 pharmacy scattered all around the kingdom. And according to recent study, that today we are at 5 minutes from 60% of the population in Saudi Arabia. This is a huge reach that will enable us to do certain mission, and I'll talk about it throughout my presentation. But 5 minutes to 60% of population with 60 million visitors per year, this gives us a lot of advantage, a lot of opportunity to serve the community better. We are existing in 78 cities around the kingdom. قحم، أبو عريش، المجاردة، الخرخير، مهد الذهب، طريب، رياض الخبرة، راس النورة، حفر الباطن. You go there without passport. These are all cities and remote towns in the kingdom of Saudi Arabia. تواجدنا في هذه المدن والقرى, it's giving us a lot of opportunities, a big opportunity of interfacing and interacting with communities. Let me share with you some of our thoughts about healthcare and what are the challenges here. Of course, private retail pharmacy are scattered all around the kingdom. So this will enable primary healthcare services and community services for the retail pharmacy to do with community. If we look at Saudi Arabia today, we are one of the highest growing country of 2.6 birth rate. But more importantly, that we are projecting that we are going to be 6.7% in terms of Saudi citizen over the age of 60 years old. Over 60 years old mean more chronic disease and a bigger demand for more healthcare spend. If we look at some statistic, I'm sure that there are some update because this is from last year. 3.3% of GDP in Saudi Arabia, compared and benchmarked with other countries around the world, considered as low. But what's more worrying, the government healthcare expenditure per capita of less than $500 per year. And if you benchmark and you compare it for Qatar or Emirates, it's half of that. And if you look at advanced countries, it's actually 1/10 or 1/5 of that. So we have a huge gap in expenditure. This is another also statistic showing that 6.7% of the total national budget is spent on healthcare, which still, despite the bigger value in terms of absolute number, but still represent lower compared to other parts of the world. Private pharmaceutical care should contribute with public sector to decrease the burden of government healthcare expenditure. And this is the positioning we are coming with, that we can contribute, we can help in improving healthcare spend. If you look at this slide, there are two triangles here. The inverted triangle is the cost and the other one is patient. So a big number of patients are costing very less in terms of healthcare. And very small number of patients, they are having the biggest spend. So what we need to do, we need to focus with the majority, with the bottom of this pyramid, that we improve, we help those patients with different pharmaceutical health care in terms of lowering and trying to reduce number of patients going up into the pyramid. High cost of health care is contained within hospital. And this is a reality, that more than 75% of healthcare costs in acute hospitalization. So this is the area where most of the costs are going. Now, let me talk to you about patient-centric model. Today, we are having a hospital-centric model, that everything is around the hospital. We have today 2.2 beds per 1,000 people. The normal percentage should be 3.5 to 4 beds per 1,000 people. So we have a big gap today. And this is an average across the whole kingdom. But if you take it by region, down in the south or up in the north, there is 0.6 bed per 1,000 people. So the problem is even bigger. Building hospitals is a right thing to do in order to increase number of beds to match population with international standard. But imagine a hospital-centric model mean that a healthy individual exposed to risk will leave him, with his risk until he get the disease, until he get deteriorated, until the time he need to have a bed, and then the time will start for healthcare to act. And this is a very reactive strategy. The right strategy is to work on a patient-centric model where we have prevention, diagnosis, treatment, maintenance, and recovery. Now, if we go deeper in the healthcare and patient-centric model, we'll find that there are a number of stakeholders surrounding the patient. And one of them is community pharmacy. Does community pharmacy exist in Saudi Arabia? This is a question mark. But it's clear that community pharmacy is an integral part of the total healthcare. And we need to work on this model. Otherwise, we're not going to match all the expansion and all the increasing costs in the future. So, patient-centric model is aiming to educate, support, and do intervention with patient to provide effective and efficient use of medication. So, community pharmacy is an essential part, an integral part of healthcare system, and will help to improve the overall healthcare system and outcome. Now, I'd like to talk about community pharmacy and traditional pharmacy. طبعا دكتور محمد, he mentioned that I graduated 24 years ago وما بكبر الدكتور صالح ومن أساتذتي في الكلية. Let me just have the freedom to talk about like the traditional pharmacy and how it started. Before the 70s, pharmacists used to dispense medication and their orientation was in drugs. So dispensing, combining drugs, combining products, it's more related to chemistry. And then after the 70s and in Saudi Arabia, probably in mid-80s, clinical pharmacy started. And a new role for pharmacists start to appear. And that's focusing on physicians and helping physicians making the right decision, adjusting doses, working with unit dose, drug-drug interaction, and all different things that clinical pharmacists do in a hospital. And the orientation were more on the process. So unit dose, hospital pharmacy management, and so on and so forth. Now, the role of the pharmacy is evolving to something called community pharmacy. So community pharmacy is focusing on patient, and the orientation will be on outcome. And the objective is to make a significant change in patient life. This is the true role of pharmacists that really can contribute. Probably what we see today, pharmacist is a salesman, standing behind the counter, handling cashier, and dispensing product, and probably he's more commercially driven in dispensing more profitable product. But I don't think this is the role of pharmacist after all his education and qualification. So community pharmacy, to define it, is a patient-centric pharmacy in which the pharmacists cooperate with the patients in implementing and monitoring a cost-effective therapeutic plan that will improve patient outcome and quality of life. What community pharmacy will provide? Community pharmacy will provide awareness. Community pharmacy will provide education and empowerment, improve understanding of diseases, achieve better control in the treatment regime, increase self-care and behavior and prevention. When we talk about prevention, for example, immunization, self-care risk factor assessment, general screening, healthcare education and counseling and advice, disease monitoring, another added value that community pharmacy can do, with patient self-management support to better control of healthcare condition, patient compliance, management of adverse drug reactions, and so on. Drug and therapy monitoring, managing patient medication record and file, provide patient with medication action plan, provide patient with full consultation service, and drug information center. So in brief, there is a new model of care. Now, are we talking about something theoretical? That's something let's try to explore, that is it gonna work or not? Now, I'd like to share with you a real example that happened in the United States with a collaboration between Joslin Diabetic Center. It's one of the oldest diabetic center in the world, more than 100 years old. It's an affiliate of Harvard Medical School. And Dr. Walid is a very famous there because he worked in that center for some time. And Walgreens is the largest chain of pharmacy in the US with more than 8,000 pharmacies across the United States. They both collaborate and work on a program on diabetes, dealing with 41 million Americans that they are exposed to diabetes and 21 million Americans that they are already having the disease and they are diabetic. This program includes awareness activities, wellness, prevention, continuous education program, medication regime, and it turned to be a very successful collaboration that really helped patients to live better life and better control for their disease. So starting from the store display areas and all the devices, all the supplement and special food that diabetic patients will require, all the way to diabetes corner resources, where you have a qualified pharmacist with an orientation on diabetes. And I've seen it myself. I saw some pharmacists with a name tag here called HIV pharmacist, diabetes pharmacist. So they are specialized in certain chronic disease areas where they can fulfill certain mission to support and help the other healthcare provider. Now, I'd like to go fast. Chain of pharmacy can implement community pharmacy practice. Now, what are the requirements for this community pharmacy to have in order to provide such service? They need to have critical mass in order to invest in logistics. They need to invest in training and improve the quality of their pharmacist. They need to have product safety. They need to have good softwares and good systems to interact and talk to other healthcare providers. Because at the end of the day, it's a community-centric, it's a patient-centric model where everybody have to talk and surround the patient in his journey. Now, if you compare this to Nahdi today, with 60 million people, we are more accessible and more close to community. We can help in managing chronic disease. We can manage in complexity of treatment, and we can provide a good interface between different stakeholders surrounding the patient. So, to prove the concept, we launched this initiative. It's a corporate social responsibility program. If you notice here, this is our logo. It's not launched, so this is the first time we are exposing this initiative to public. The blue circle is the circle of diabetes, and you can see a Nahdi logo start to appear here. We are calling this Nahdi الأمل. فإحنا we are using it for both نهدي من اسم النهدي أو نهدي الأمل، وهي إحدى مبادرات شركة النهدي للوقاية من السكر. Why diabetes? It's around 25%, 1/4 of population are diabetic. But what's more worrying, that by 2030, 50% of the population will be diabetic. And this is seriously, alerting everybody that we have to act. What's our objective? Our objective is to work on awareness and prevention, early detection, and improve quality of care. So we are not replacing the role of physicians. Pharmacists, they will play their role. They will synergize and work hand in hand with other healthcare professionals really to improve treatment and control of diabetes. We have signed a long-term agreement with Joslin Diabetic Center to work on this program together. And we are also working with the Mizan Group. This is a social media that address young people in quality of life, lifestyle, food habits, and so on. We have 3 phases for this program. The first phase was last year, where we conducted a workshop, and we conducted also qualitative research. We went to people in their home. We've seen what they eat, how they eat, what's their habit, and it's really, alarming. So we had this workshop. We invited all the key opinion leaders, all the key people that they are concerned about the disease, and we really understand more about the role of community pharmacy in diabetes. Phase 2, that we are going to do this year, will be 2 parts. One part will be an awareness and prevention campaign. While we are doing this campaign, we'll start to work on our pharmacists, to train them. We'll work on our system to upgrade them and to be able to talk and interface with different stakeholders. and also would like to do a pilot to prove the concept. This pilot is a triangle that will have healthcare provider, will have insurance company, and will have community pharmacy. And then we have a controlled number of patients where we will work with them with certain programs, and we will see what will be the result and how we are really controlling and managing diabetes. الله يكرمك. شكرا لك. شكرا على دعوتكم. الله يكرمك. شكرا لك. شكرا يا دكتور. أكرمك الله.
Madinah Institute for Leadership and Entrepreneurship, MILE.